Hello, everyone. My name is Awais Gandhi, and today I'm going to be talking about the significance of urine leaks in children with blunt renal trauma. So, in children, the kidneys are one of the most commonly injured organs, with blunt renal trauma accounting for almost 90% of renal injuries. The management has always been organ preserving and conservative, even at higher grades. And outside of hemodynamic instability, the guidelines on surgery are not very clear. Urine leaks can be initially clinically silent. However, it can have delayed complications such as hydronephrosis, electrolyte imbalances, and abscess formations. And it can often be misdiagnosed for ascites, pelvic or abdominal abscesses, or other abdominal masses. The diagnosis is done by CT scan with delayed images being key. Other modalities are ultrasound, renal scintigraphy, and intravenous pyelography. Management depends on the size. If it's small, they spontaneously reabsorb. However, large ones need image-guided drainage or transcystic stenting. The purpose of our study was to assess the effect of urine leaks on patient outcomes, as well as to assess risk factors that may help guide to earlier detection of urine leaks, and evaluate our current blunt renal trauma protocol, which is only grade dependent. As you can see in this image, the trauma protocol is basically dependent on the grade of renal injury. And we wanted to see if we can change this to have more inclusion for urine leaks. We did a retrospective review of all patients less than 18 and got a total of 356 patients. We looked at outcomes. We looked at the following patient outcomes, including length of stay and ICU days, operative procedure rates, mortality, and others listed here. The results were that almost all urine leaks were in grades 3 and above, with the most number of urine leaks being in grade 4 and the highest proportion being in grade 5. When looking at the total cohort of both multisystem and isolated renal injuries, we found urine leaks to be associated with fevers, 90-day readmission rates, operative procedures, and urological causes of readmission. When looking at isolated renal trauma, we found the same association between urine leaks and fever, as well as 90-day readmission and urological causes of readmission. And operative procedures were trending towards significance. In conclusion, urine leaks have a considerable association with complications and readmissions, which warrants further evaluation of our protocol so that it is more based on decision trees, which include urine leaks. Finally, multivariate analysis is needed to predict urine leaks, which will lead to earlier detection, which is what our current manuscript is trying to do. That leads us to the end of my presentation. Thank you very much.